Hello and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, summer is the season when we all want to flaunt our beautiful skin. But the scorching heat and harsh sun rays can damage our skin, leaving it dull and lifeless. Therefore, it is crucial to take proper care of our skin during the summer season. So, to discuss on the topic, we have with us Dr. Nazneen Jahan, dermatologist. So not to waste any more time, I'll straight away move to her and talk more on the topic which we have taken today. Well, thank you so much, Doctor, for joining to Good Life, the health show. So today, the topic which we have taken is like how to take care of our skin during summer season, which is, of course, a question which is surfacing in everybody's mind. Now, does summer affect your skin? Now, that is my first question to you.
Okay. Thank you, Pooja. First, I'd like to introduce myself. Hello, everyone. I'm Dr. Nazneen, practicing at Dispur as a dermatologist. So, yeah, summer does affect our skin in many ways because of the extreme heat. So, nowadays we can see that the temperature is soaring high, and because of that, there is a lot of sweat developing. The sweat is actually an irritant for the skin, so it causes a lot of irritation and many allergies, those kind of things on the skin. And especially in the summer, because of the excess rays of the sun, we tend to have tanning, sunburns and all these things. So like every season, summer has its own role to play in the skin.
All right. Now, how to take care of skin during summer? What are the tips you would like to give our viewers who are watching our show?
Okay. During summer, we should have proper sunscreen applied. Not only during summers, during every season, sunscreen should be applied. So, especially during summers, I get a query from the patients that they tell me that I sweat a lot. So, when I sweat, my sunscreen flows out with the sweat. So, we have a lot of sunscreens where it's written sweat resistant, and matte finish sunscreen sweat resistant. Those are there now available in the market, so you can use those. And whenever we move out, we should take protection like wearing hats or taking an umbrella, wearing a mask, protective clothing, all those things. And when we go out, we should wear cotton clothes preferably, because if excessive sweat accumulates, that leads to a lot of problems in our skin. So that should be avoided. And the moment we come from outside, especially in the cities, there's a lot of pollution. So we need to keep our skin clean. We need to wash all the dirt on our face properly. And even though it is summer, some people tend to have a little dry skin. For them, I suggest that you apply good moisturizer, especially at night time.
Okay. Now, people with different types of skin might have different problems during summers. Now, if we talk about the types of skins we are talking about, now if we talk about the skin which is majorly affected during summers, so which are those?
Majorly affected are those people who have a sensitive skin.
Sensitive skin.
There's something called atopy. Okay, these people tend to have skin which are very sensitive, and that itches quite a lot. More in the winters and also in the summers, they are not able to tolerate the sweat properly.
Okay,
they develop some skin problems like sweat dermatitis, and those people who are more exposed to the outer environment, like who have to go out in the sun, who have to move out in the sun, they are also affected a lot. So because of the heat, there is a lot of miliaria, which is 𝗟𝗜𝗙𝗘𝗔𝗦𝗧, that miliaria develops. It leads to a lot of other problems as well. Sometimes the skin infections develop, and because of the excess humidity in northeast, we have a lot of humidity, and because of that, fungal infections are also on the rise, especially during the summers. So everyone suffers, but the people who have a sensitive skin, the people who sweat a lot, they are more vulnerable.
Okay. Now, talking about the children, doctor, because the children are very tough to handle during summers or any kind of season for their protective skin. So for them, like a lot of products are available nowadays in the market. So especially for the children, which are the products to be used, or is it of course like suggested to consult a dermatologist before using those products?
Nowadays, we get a lot of products in the market, but especially for children, we should try to minimize the use of the products. Use a good moisturizer meant for the babies. Something which doesn't have much of a fragrance, not too many things in them, paraben free, all these things are written. So we should take care of that. And some more than 2 years of age, we can use sunscreens to children. Some people who have some skin issues, we give in earlier cases also, before 2 years also, but mostly after 2 years, we can use sunscreen which contains physical agents, like we will see that it's written zinc oxide or only physical sunscreen. Those sunscreens which should not have these chemicals, we can use in the babies, and we should try to keep them in a cool environment under the fan or where there's an AC, and give them enough of liquids to drink so that they don't suffer from dehydration.
Okay, so proper hydration is very important.
Yes,
okay,
that's important.
All right, viewers, our numbers are flashed on your television screen. So if you have any queries regarding the topic which we are discussing at this point in time, please call up and ask your question. All right, Doctor, coming back to you again. Now, if we talk about the children, now they suffer a lot with malaria, which we say 𝗚𝗢𝗙𝗧𝗛 in Assamese. Now, if we talk about those, now how the parents, or what kind of tips you would like to give to the parents to take care of their children?
Yeah, these children, whenever they have this, their parents are sometimes confused. Most of the parents diagnose, but some people get confused. So I'd like to say that these are small, tiny red bumps, especially on those areas where there is accumulation of sweat. So when this appears, people should take care that the children stay in a cool environment, give them AC, fan, whatever, and cool the area. The area should be washed with cold water 3-4 times per day.
Okay.
And we should not apply too much sticky things, creams, okay, on them. And main thing which cures this malaria is keeping the environment cool. That will automatically tackle the problem. We don't need too many medications for that.
All right, all right, all right. All right, we have a caller at this point in time. Let's take the call and then we'll proceed with the conversation. Hello.
Hello.
আমি শুনি আছো আপোনাৰ প্ৰশ্নটো কৰিব
হয় মই মোৰ বয়স 26 years old হয় মোৰ ফেসত বহুতখিনি আনইভেন টোনস আছে লাইক নাকৰ কাষত চকুৰ কাষত আৰু ওঠৰ কাষত স্পেসিফিক্যালি মোৰ চকুৰ তলত 8 months পাৰ হ'ল ডাৰ্ক সাৰ্কেল বহুত হৈ গৈছে আপুনি মানে কি ক'ব পাৰে যে এটো কি প্ৰসিডিউৰ কৰিলে বস্তুটো অকন ভাল হ'ব পাৰে হোম ৰেমেডি তেনেকুৱা যদি থাকিলে হয়
uneven skin tone. Uneven skin tone to খুব common, বহুতৰে হয় আৰু কিছুমান মানুহৰ মানে uneven skin tone হোৱাৰ পিছত তেওঁলোকে sun exposure হয় বা কিছুমান factors থাকে, multiple factors, তো হেতুৰ কাৰণে এটো ঠিক নহয় কেতিয়াবা, তো তেওঁলোকে কি কৰিব লাগে sunscreen use কৰিব লাগে regularly. Sunscreen use কৰিব লাগে আৰু যদি moisturize sunscreen clean your face এই তিনটা step সদায় আমি follow কৰা উচিত আৰু তাৰ পিছতো যদি আপোনাৰ problem হৈ থাকে বেছি uneven আছে তেতিয়া হলে আপোনাৰ pigmentation কোবা develop কৰিব পাৰে তেতিয়া আপুনি কোনো dermatologistৰ help লওক তেওঁলোকে আপোনাক procedure suggest কৰিব পাৰে skinৰ chemical peeling আছে laser toning আছে এইবোৰ procedure কৰিলে skinৰ tanning খিনি গুচি যায় আৰু evenness এটা আহে
All right, thank you so much for calling at this point in time. All right, doctor, these are some of the basic questions which come up with everybody. Of course, taking care of skin is very important during every season, we can say. Now, we were talking about the malaria problem that is said 𝗚𝗎𝗪𝗔𝗦𝗧 in Assamese in children. So, how parents can take care of their children?
Yeah, like I said, the parents should avoid too much heating up. No, whenever, especially during the noon time, whenever there is too much heat, we should avoid taking the children out in the sun. After playing, we should keep away the clothes which are already filled with sweat. Change it, keep them cool, regular bathing, and give them enough of water to drink. And when malaria develops, the area needs to be cleaned with cold water 3-4 times a day. And we can apply some light lotions also, like some lotions contain calamina lotion. Those are very soothing for the skin. Those can be applied.
All right. Now, this sun protective accessories and also the light clothing also helps a lot for the protection. So, what suggestions you would like to give our viewers?
We should wear clothing that absorbs sweat, especially in summers, because in Western countries, the environment is totally different. The climate is different. Here, it's totally different because here there's a lot of humidity and we tend to sweat a lot. So we need to wear clothes that absorb sweat, like cotton clothing, some loose clothing, not too tight clothing, because that will tend to worsen skin problems. And these people should keep their skin clean, okay?
Hygiene is very
hygiene is very important. So those are the things we should take care of.
All right, doctor, we'll have more discussion, but we'll have to take a break. All right, viewers, will slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching Good Life, the health show with me, Pooja, and we are having a fruitful discussion on how to take care of your skin during summers. Now, doctor, coming back to you again. Now, we have seen like a lot of people tend to have more acne outbreaks in summer. So what is the reason behind it, and what are the treatments that can be done?
Acne outbreaks, they are quite common nowadays. Even not only teenagers, even the adults tend to have a lot of acne, especially in cases of women. And it is not always that only because of the heat, because of the hormonal issues, because of diet, stress, all these factors also play an important role in the development of acne. Especially during summer, some people tend to have outbreaks because of the humidity. So when we apply some makeup or anything on our skin, along with the humid environment, along with the sweat and dirt, these tend to clog our pores. And because of that, there is more infection and more outbreak of acne. So especially there is a organism called P. acnes, which is responsible for the development of acne. So that plays a role. To prevent it, you're asking, To prevent acne, we need to first keep our skin clean. We need to wash our face after we reach home with a good face wash. We don't need too many chemicals, but any good face wash containing glycolic acid, salicylic acid, all these things are there. We can use those face wash. We should avoid very sticky creams, avoid makeup as far as possible, maintain a healthy diet, drink enough of water, and keep our stress at bay. Because stress plays a major role in the development of acne.
So we have also heard that stress plays a major role in like evolving these acnes on your skin. Now we have seen the lifestyle have changed. A lot of like physical activities have come to an end. Now we have seen that exercise or the proper diet is very important to have a healthy lifestyle, isn't it, doctor?
Yes,
so what suggestions you would like to give our viewers regarding the lifestyle modalities to be implemented in our day-to-day activity?
In our day-to-day lives, we need to have some kind of physical activity. That is very important. That keeps us healthy, not only physically but also mentally healthy. And whenever we grow fat, we have too much of body fat in our body. That acts as a substance which promotes development of so many diseases, not only internal diseases but also skin diseases like and even acne outbreaks occur. Even PCOS, which is so common nowadays among women. If we keep our weight at check, most of the issues which PCOS gives us, like acne, like increased hair growth on the face, all these things also can be controlled. So we need to do some regular physical activity, and we need to avoid junk food. That also plays a role. And too many nowadays people go to gym and they take supplements. That's very common. And those contain whey protein. So many supplements contain whey protein. So people who are prone to acne, they should avoid the whey protein. Instead, they can take some other protein like eggs, because a lot of people come to me with acne, and when I ask them that do you go to the gym, they say yes, and I just tell them, are you taking whey protein? And obviously the answer comes in a positive manner. So that is one factor which nowadays plays an important role. And that's what exercise and diet and keeping the face clean, avoiding all the things which lead to development of acne, like sticky things, makeup, and we should not prick. Whenever we develop one small acne, we should not try to squeeze it with our fingers or prick it, because that leads to aggravation of lesions.
So those are some of the tips. Now, when a patient comes to you, so of course you take the history of the patient and what kind of like the cream or the products they use. Now, on that note, do you change the products immediately or ask them to continue with the products if it is okay with them?
If the product is okay, then they can continue, but certain things are not suitable for some kinds of skin. So some people will apply sunscreen that are on a very creamy base with oily skin. If on top of
not suitable for the skin.
Suitable, in that case we can change.
And do you also give some supplements to take?
Supplements in the sense, mostly we give
vitamins.
Vitamins play a minor role in case of acne. Mainly maintaining a good healthy diet is more important.
Okay. Now, doctor, what are these acne scars or acne marks, which also has a lot of because that might lower your esteem or lower your confidence among the people which we see. So what are these acne marks and how to treat them?
After the development of acne, even when the acne is gone, they leave some marks on your skin. So one is it develops a blackish kind of a mark on the skin.
Okay.
That is a pigmentation type of a thing. And another, it develops scars. Scars are some there are some pits on the skin. Okay, the skin looks very uneven and there are some pits. So once you develop a scar, it's really very difficult to get rid of the scar. There are so many treatment modalities available, like we can go for microneedling, we can go for derma rollers, laser treatments, all those things are available for scars, but none of these give 100% results.
Okay.
So it is best to prevent it. That, like we say, prevention is better than cure. So in case of acne scars, we should follow that. We should be very careful when we develop acne. We should not ignore this.
Okay. Now, as you mentioned about these laser treatments, now how safe are these treatments and how you build up confidence among the patients when they come to you when you start about the laser treatments?
These laser treatments are quite safe when done by a specialist, because we need to know how much thing to apply, what to give exactly.
Okay.
So when they are rightly applied, they are very safe for the skin, and it helps in rebuilding the collagen. It gives a glow, it improves the scars, and it also helps remove the marks.
And are any tests also recommended to be conducted, or any kind of blood test to measure out things, that is there any problem with the blood? If we are talking about skin?
Yeah. In some patients, especially in cases where we suspect PCOS, in those cases we need to do some blood tests to see their hormonal profile. We maybe need to do an ultrasound even to see how whether it's a PCO pattern ovary. So these kind of tests are required, and some patients need higher medications for acne. So we need to give some tablets that are continued for 4-5 months, like isotretinoin tablets. In those cases, we need to check the blood.
All right, doctor. Now, if you want to know about the basic skincare during summers, now we have seen a lot of people, though they don't immediately go and see a skin specialist or a dermatologist, but they will awfully see that there must be some kind of home remedies which can be opted at home as well. So is there any other home remedies or any home remedies which can be applied at home itself, and then if the thing persists, we can of course go and see a dermatologist?
In case of acne?
Yeah. In case of acne or any kind of skin problems during summers.
Yeah. During summers, like if you have miliaria, like we discussed, home remedy is the mainstay of the treatment. So staying cool, applying cold water, washing with cold water, that will give you a lot of respite from the problem.
Okay.
And especially when you have an acne outbreak, you need to wash your face regularly. Like I mentioned, in some face washes, you see that it's written salicylic acid or glycolic acid containing face wash. So these can be used once or twice a day. And people apply some home remedies which may be harmful to the skin. Like some people apply lemon, squeeze lemon on the face to get rid of acne. Some people apply ginger, some garlic. So these kind of things should be avoided.
So directly putting lemon is not at all?
Not at all advisable.
Okay.
You better clean your face regularly. Or even if you want to apply something, you can take clindamycin. Plain clindamycin ointments are available. They are available over the counter. You can use those on your skin. And a lot of people, when they go to the pharmacies to get quick remedy, they take some creams which contain steroids. Like I can mention some names like No Marks, or some creams are there which contain steroids. So these aggravate the problem. Initially it might seem that you are getting a cure, but in the long run it aggravates the problem. The acne aggravates and the skin issues aggravate.
Okay. Now, doctor, if we talk about in general, now how helpful are these home remedies for any kind of skin problems which you're having?
Home remedies in the sense, like if we maintain a healthy diet, if we keep our face clean, you apply less amount of makeup, and you take good care of your skin otherwise, in those cases, so many skin problems do not appear. So we can prevent those. And when we have a skin issue, I suggest that if you have a major skin issue, if it's troubling you for a long time, you better take the help of some specialist, because just one consultation can save you a lot more in the future.
And Doctor, like how important is to keep yourself hydrated during summers and of course for any kind of like skin problems which one or the other is facing?
Yeah, that's very important because especially in summers and especially in case of children, because they tend to run around all the time and they tend to sweat a lot. Sometimes they don't know that water is important for them. So we need to keep them hydrated. And for ourselves also, we need to stay hydrated, water, whatever it might be, water, fruit juice, ORS, whatever it might be, we need to stay hydrated because that will help keep our skin healthy.
All right, Doctor, we'll talk more, but we have a caller right now. Hello?
Hello, can you hear me?
Yeah, I can hear you. Please ask your question.
Okay.
Hello?
Can you hear me?
Can you please reduce the volume of your television so that we can hear your question properly?
Hello, can you hear me?
Yeah, I can hear you. Please ask your question.
Okay. During summer, how many times should we take bath and how many, hello, can you hear me now?
I can hear you clearly.
Okay, during summer, mainly how many liters of water should we drink and then how many times can we take bath? If we take bath for summer, it will be good for the healthy.
Okay. How many times to take bath and like how often we should drink water?
Water. Okay. How often? How often actually we should know how much to drink water, because around 2.5 liters of water per day is the average. If you are sweating more, you need more water. And how often to take bath? Once or twice is enough. If we bath too frequently or too frequent use of soap, that might take away all the oil which is naturally present in your skin, making your skin dry and making it prone to other problems. So like too much of everything is bad.
Too much of everything is bad. Thank you so much for calling. So, of course, the doctor which you have just mentioned that too much of everything is bad. But if we were talking about this, like to keep ourselves proper hydrated is very important, not only for summers, but for to have a proper healthy lifestyle and to keep away all those diseases which one person can have. So if we talk about the diet, now, which are the products which we should include in our dietary section?
When we talk about a healthy diet, we should include green leafy vegetables. We should avoid processed food as far as possible, avoid the junk food. Milk as such is not bad, but if you are prone to develop acne, you should avoid milk and milk products.
Okay.
Too much of oily food, that should be avoided. And citrus fruits, the fruits which contain vitamin C containing foods, those are good. They contain antioxidants, and beta carotene containing food like carrots, those are good. All kinds of vegetables, and fiber and a lot of water. So that's important.
Okay. And which are the most number of cases or most number of like issues which you get every day in your clinic, doctor?
Nowadays I'm getting a lot of cases of acne. That's why I'm focusing more on that. I'm getting a lot of people with acne, especially the females, young girls as well as the older ladies who are maybe in their 30s. They are also developing a lot of acne because we see that so many people are coming with hormonal issues, hormonal acne nowadays. And especially in the summers, along with the sweating, a lot of issues on the skin because of the sweating, and fungal infections. That happens because we tend to live in a hot and humid climate. When there is more humidity, when the sweat accumulates, then it helps the fungus to grow. So we get a lot of fungal infection cases.
And how long is the treatment procedure, doctor? Is there a fixed timing or it depends on the patients as well?
Yeah, it varies from person to person, but around a month of treatment is required. Sometimes people take medications and they stop it after a week or two. But in that case, it tends to recur. It tends to keep coming back again and again. So we need to follow the doctor's advice. So as if it's written for 6 weeks, then we should follow it accordingly.
Okay, well, you should not stop the medicines in between. Of course, take the recommendation from the doctors as well. Doctor, we are really short of time. So what message you would like to give our viewers who are watching our show?
I would like to tell the viewers that stay hydrated, keep your skin clean, and the skincare is a very basic thing. We don't need to complicate, because we see so many Instagram reels, so many things nowadays that if you don't apply this is going to harm your skin, this, that. Too many products you don't need. You just, to maintain a healthy skin, you need to be healthy first. So we need to have a healthy diet and a healthy lifestyle.
All right. Thank you so much for that lovely message. And I'm sure the viewers who have watched our show must be benefited with the answers just Doctor gave. And with this, we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.